CNA repositioning techniques. Welcome to the quiz. Question 1. During your shift, Mrs. Sarah Anderson, a family member of one of your patients, approaches you in the hallway and asks you detailed questions about her relative's medical diagnosis, current medical condition, prognosis, and specific details about the treatment plan. She seems very concerned and wants to understand everything about her relative's healthcare. You want to be helpful and responsive to the family member's concerns, but you also understand the importance of maintaining appropriate communication boundaries and ensuring that confidential information is handled properly. When a patient's family member asks you about the patient's medical condition and diagnosis, what should you do? Option A. Provide the family member with complete and detailed medical information about the patient's condition, diagnosis, treatment plan, and prognosis, as family members have a right to know all details. Option B. Refer the family member to the nurse or appropriate healthcare provider, as it is the nurse or physician's responsibility to discuss the patient's medical condition and answer specific questions about diagnosis and treatment. Option C. Tell the family member that you cannot discuss the patient's medical information with them and suggest that they speak with the patient if they have questions. Option D. Share general information about the patient's condition, but avoid mentioning any specific diagnoses or treatments, to provide some information without giving away too many details. The answer is B. CNAs are not authorized to provide detailed medical information or diagnoses. That is the role of the nurse or doctor. Option B is correct. Option A is a breach of confidentiality and scope of practice. Option C is not helpful. Referring to the patient may not be appropriate if the patient is confused or unable to communicate. Option D is still inappropriate. Any sharing of medical details without proper authorization can violate HIPAA. Question 2. You're orienting a new nursing assistant to your unit and reviewing important admission procedures and activities that should be performed when a patient is newly admitted to the hospital. You are discussing with her the important initial hygiene and personal care activities that should be provided as part of the admission process. Based on standard admission procedures and protocols for promoting patient comfort and cleanliness upon arrival to the hospital, which hygiene task should routinely be performed for all patients upon their admission to the hospital? Option A. A complete head-to-toe bed bath should be performed on all patients, regardless of whether they can shower or bathe independently, as this is always required during admission. Option B. Hair washing should be performed immediately upon admission, even if the patient is very ill or unstable, because hospital policy requires all patients to have clean hair. Option C. An initial bath or shower should be offered and performed if the patient is physically and medically able to do so, both to promote cleanliness and to allow the patient to feel fresh and comfortable after traveling to the hospital. Option D. Nail trimming should be performed as an immediate priority during admission, as long nails can cause injury to the patient and other staff members. The answer is C. Upon admission, an initial bath or shower is offered based on patient ability and preference. Option C is correct. Option A is incorrect. Not all patients need or can tolerate a full bed bath. Option B is incorrect. Hair washing is not an immediate priority and can be unsafe for unstable patients. Option D is incorrect. Nail trimming is not an admission priority and may require assessment. Question 3. You are providing care to Mr. Richard Hopkins, a 68-year-old male patient who is hospitalized for acute illness. During your shift, he refuses to allow you to assist him with bathing, tells you that he does not want to take his medications, and refuses to allow you to reposition him in bed or assist with range of motion exercises. He states clearly that he does not want these care activities performed. He seems anxious and states he wants to be left alone. You recognize that patients have the right to accept or refuse care, and you need to handle this situation appropriately while respecting his autonomy. When a patient refuses care or treatment that has been ordered by their healthcare providers, how should you respond? Option A. Force the care to be provided anyway, as medical orders must be followed regardless of what the patient wants, and you have a responsibility to ensure all ordered care is completed. Option B. Respect the patient's wishes and refusal of care. Document his refusal in the patient chart and notify the nurse immediately so that the refusal can be addressed and the reasons explored. Option C. Tell the patient that he must comply with all medical orders and that refusal is not acceptable, and threaten to report his behavior to the doctor if he continues to refuse care. Option D. Document that the patient is being uncooperative and unruly, and avoid that patient for the remainder of your shift while hoping he will change his mind. The answer is B. Patients have the legal and ethical right to refuse treatment. Option B is correct. Respect the refusal, document it, and report it to the nurse so the nurse can reassess and educate. Option A is assault. Option C is coercive and disrespectful. Option D is abandonment and fails to address the situation. Question 4. You are preparing to change the bed linens for Mr. George Martinez, a 71-year-old patient whose bedding has become soiled with urine and feces due to incontinence. You understand that when handling soiled linens and caring for incontinent patients, specific infection control precautions need to be taken to prevent the transmission of infectious agents from body fluids to yourself, other patients, or the environment. When changing soiled bed linens and providing care to an incontinent patient, which infection control precautions should you use? Option A. No special precautions are necessary when handling soiled linens, as long as you wash your hands at the end of your shift. Option B. You should use standard precautions including wearing gloves, handling linens carefully to avoid dispersing contaminants into the air, placing soiled linens in designated containers, and performing appropriate hand hygiene after care is completed. Option C. You should wear a full hazmat suit including respirator, goggles, and all protective equipment because urine and feces are extremely dangerous. Option D. You should wear only a surgical mask without gloves, as the mask will protect you from any infectious agents present in the soiled bedding. The answer is B. Standard precautions apply for contact with body fluids. Gloves are essential and soiled linens must be handled to minimize contamination. Option B is correct. Option A is wrong. Hand hygiene alone is insufficient. Gloves are required. Option C is overkill and unnecessary. Option D is wrong. A mask does not protect hands from contamination. Question 5. You are caring for Mr. Stanley Brown, a 75-year-old male patient who reports experiencing constipation and has not had a bowel movement for 3 days. He is uncomfortable, complains of abdominal bloating and discomfort, and is concerned about his bowel function. He is looking to you for advice about what he can do to help relieve his constipation. You know that there are several non-pharmacological interventions that can help promote bowel function before resorting to medication. Based on your knowledge of interventions to promote normal bowel function and relieve constipation, which action should you recommend first? Option A. Immediately administer a strong laxative medication without waiting, as medication is the fastest way to relieve constipation. Option B. Increase the patient's fluid intake, encourage him to eat foods high in dietary fiber, and encourage ambulation and movement if medically appropriate, as these measures promote normal bowel function. Option C. Place the patient on complete bed rest to allow his bowel to rest and recover and restrict his food and fluid intake. Option D. Give the patient only clear liquids and foods with no fiber or bulk, as this will prevent further constipation from developing. The answer is B. First-line interventions for constipation are non-pharmacological: fluids, fiber, and mobility. Option B is correct. Option A is wrong. Administering medication is outside CNA scope and not the first step. Options C and D are wrong. Bed rest and low-fiber diet worsen constipation. Question 6. You're assisting Mrs. Betty Thompson, a 70-year-old female patient who has gastroesophageal reflux disease, GERD, with positioning and comfort measures. She frequently experiences heartburn and acid reflux, particularly when lying flat in bed. She is uncomfortable and asking for your help in finding a position that will be more comfortable for her symptoms. Based on your understanding of positioning for patients with GERD and gastric reflux issues, which position would be most comfortable and therapeutic for this patient? Option A, lying flat on her back in bed would be the most comfortable, as this allows the esophagus to relax and the stomach to empty more easily. Option B, the semi-Fowler's position, head elevated 30 to 45 degrees, or high Fowler's position, head elevated 45 to 90 degrees, with support provided by pillows would be most comfortable, as elevation helps prevent reflux. Option C, the prone position, lying face down, would be most therapeutic for her reflux symptoms, as this position helps with digestion. Option D, the Trendelenburg position, head lower than feet, would help with her heartburn, as this position aids with stomach emptying. The answer is B. Elevating the head of the bed uses gravity to prevent stomach acid from flowing back into the esophagus. Option B is correct. Option A is wrong. Lying flat worsens reflux. Option C is wrong. Prone does not help and may be uncomfortable. Option D is wrong. Trendelenburg, head down, actually promotes reflux. Great job. Don't forget to subscribe. Bye.